It's now my great pleasure to introduce our next guest, our guest of honour today, the Chief Health Officer, Dr. Kerry Chant, also the Deputy Secretary of Population and Public Health. Dr. Chant leads the Population and Public Health Division, which has accountabilities for quite a broad range of portfolio issues, including tobacco control, reduction of risk drinking and obesity, the promotion of physical activity and end-of-life care, as well as organ donation. In her role as Chief Health Officer, Dr. Chant also works closely with the Office for Health and Medical Research, which also supports the state's leading health and medical research efforts. We're really honoured to have her with us today to celebrate this week, which is raising awareness, of course, about health literacy. Ladies and gentlemen, please put your hands together for Dr. Kerry Chant.
Thank you very much. I'd like to begin by acknowledging the traditional owners of the land on which we meet, the Darug, Tharawal and Gandagara people, and thank you very much, Malcolm, and I'm not going to in any way compete with your multiculturalism. I'd like to also acknowledge all our guests here today and everyone who's really participated. Look, that was a fantastic, grounding speech, and I've taken some copious notes and going to remember every time I see a brief that has an acronym in it that I don't understand, I'm going to send it back to the team. So thank you. I'm pleased to be with you here today to launch Multicultural Health Week 2018, focused on health literacy, with the tagline, Talk, Listen, Ask for Better Health. Southwestern Sydney is one of the most diverse communities in New South Wales, and in this diversity is incredible strength. I had the privilege of working in this place for over 15 years, and it was one of the times of my life which I most enjoyed. The sense of vibrancy, innovation and commitment. So I commend anyone to come and work in Southwestern Sydney. I'd like to congratulate the New South Wales Multicultural Health Communication Service, and I'm not going to use the acronym now, for coordinating this year's Multicultural Health Awareness Week. And I'd like to especially commend this year's Multicultural Health Week Advisory Committee for proudly showcasing the theme Health Literacy. In the New South Wales State Health Plan towards 2021, health literacy actions are a key priority area. It's around helping people to manage their own health and empowering patients to be partners in their care. The health literacy actions that New South Wales Health has identified in the state plan are improving consumer access to and understanding of health information and developing strategies and initiatives to help patients and carers navigate the health system. I think we've heard today how important health literacy is, and it's, I just want to make sure we don't walk out of this room thinking that it's optional, because for me, everything we've heard today is that health literacy is a right and entitlement, and we've got to think about it in every attempt we have in communicating to patients. I've got to say there's demands of health literacy which even relate to when we're communicating across multidisciplinary teams, because we tend to use different language and language in different ways. And I'd even say at the executive within a board meeting, there'll be people that come from a financial, clinical. So I think ensuring that people understand what we're saying and that we have a shared, go out of any encounter, be that a patient encounter, a clinical team encounter or a broader encounter within the community, that people understand and take from that the same meaning. I would also urge that we have, again, a health literate, I'm reframing what we've written in my speech here, because I think, again, a health literate organisation is one that shows basic respect. Shows respect for our consumers and their right to understand. I think the story of being in Vietnam and not understanding And I can remember even the challenge of navigating another health system, which was not as, when my son had an injury when I was in Canada, and an Australian healthcare system is very similar. But even that was a challenge because it was different and I felt unsafe in a different environment. So I think that we need to put ourselves in the shoes of people from culturally and linguistically diverse communities. I think we need to show empathy and compassion, but those steps about how many encounters, how many in this room has had a patient encounter in the last week with a person from a CALD community? Anyone in the room? Okay, and how many times did you use an interpreter? Always? Always. Good. You've got a select audience here. But I think even those minor challenges that you've thrown out to us is to make sure that we do get ourselves organised. There will obviously be times in an emergency department where there are challenges in that acute intensity of the moment, but I think you've set down a benchmark that every encounter with a CALD community where there isn't a strong understanding of English, we need to have an interpreter, and it's not optional, and we shouldn't even progress through to that because communicating and understanding is so important. So back to my script. This week's Multicultural Health Week aims to raise awareness for health workers of the importance of health literacy when working with people from culturally and linguistically diverse backgrounds. And we believe that when working with diverse communities, health literacy is more than language. Cultural factors play a significant role. Cultural practices and beliefs affect how people find, understand and respond to health information. So I was also touched with the challenge to co-design and the fact that we need to validate and test our communication with the communities in which we're working with. And we need to embed that as business as usual when we're aiming to interact with target communities. I'd like to acknowledge the work that's been put together for this Multicultural Week and the resources that have been produced to promote the messages of the week. A poster in English promoting the week, local health literacy projects, and I commend you outside to review the posters, and also a toolkit designed especially for health workers supporting clients from culturally and linguistically diverse backgrounds. Today we've heard very powerful and informative presentations, and I think it is on us to walk out of this room and think about what are some of the practical things. I've told you that I'm going to go back and talk to my staff about the need to not have abbreviations, not use acronyms, to challenge them to write a brief in plain English. That will be interesting. And whenever I see a project, program or brochure, I'm going to immediately ask have you actually developed that with community? Have you developed that with both English-speaking and non-English-speaking communities? And have you addressed concerns around health literacy? And also in what modalities does the community want to receive that information? And that may vary by age and other contextual factors. So thank you. You can give me a report card next year if I'm invited back to launch Multicultural Week, but I think you've put up the challenge, and I'd like everyone else in the room to actually think about and reflect in their day-to-day work, what are you going to do to embed that concepts of health literacy and the important messages we've heard from the speakers that have gone before. So thank you.